Introduction to health systems. We discussed some of this in the previous lecture, basic definitions. What you understand by different perspectives of health system and healthcare. But how will you define a health system? How the pieces fit together. Dimensions of funding, syndromes of dysfunction, syndromes of when you look at a health system, you should be able to analyze it rationally. As we said, health is a right. Health, which is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity, is a fundamental human right and a most important worldwide social goal. So that has been formed. Health comes from purchased medical care. No man, Leonard Berkoff said, no man has a right to medical care if he cannot pay for what he needs. Then he must depend on voluntary charity. There are some issues in some countries for this issue. Health is due to social conditions. The improvement of medicine will eventually prolong human life, but the improvement of social conditions can achieve this result more rapidly and more successfully. You have to distinguish between these words. When you say health versus healthcare, health refers to a state of the human body and mind. That WHO defines as health as not the absence of disease, complete mental, physical, social, and spiritual well-being of an individual. But healthcare refers to chemicals, devices, and services used by people to improve their health. That is, devices used to improve their health, all the things that we do to health. That is healthcare. Then we have heard the word health insurance. What do you mean by health insurance? Health insurance is a system of paying for unpredictable needs for healthcare. You don't know, you just pay something. If you get sick, you get funding for reimbursement. If you're reversing that money, you are not using that. So, system of paying for unpredictable needs, future risks, you pay that and this. So, in the basic definition, the economic groups of individuals brought together for a common we call our economic unit. And then economic agent is an individual with a specific role in the system. It can be a patient, a nurse, or a management. Or then you can have institutions, norms, rules of conduct, established procedures, etc. Right. These are some of the terms that you can initially go through. Adjustment, adaptation, coherence. There are 7 principal health systems. When you look at, we define the health system as a collection of interrelated, collection of organizations, institutions, facilities, resources used to achieve the improve the health of the people. So this system will have one primary health service delivery system is part of that. Then we have a health workforce, that is also another system. All these have to work together for the health system to work. Then the stewardship or the leadership and the governance part of it. Health system financing, that's another system within the health system. Supplying medical products and technologies, resources. Then the information is another system. And then the people who receive the households, which uses the system. They are also part of the health system. You see, all these are interrelated things which works together to provide health care to the people. There are people make mistakes. First mistake is to think that the public sector service delivery is the health system. So, some people when they talk of a health system think of only the public sector. No, there can be other systems also of health care delivery, the private system, etc. So it's a mistake that people make. The public sector is never the whole health system. It's not only the delivery, the institutions, even the people are part of the system. They are also part of the. People think that they leave the people from the system when you talk of a health system. Yeah, because we say they are important as stakeholders. They should participate in the whole affairs, delivery of care. Uh, Stakeholders. So therefore, some people leave out public, the people or the households when we talk of a health system. Private finance, private supply chain, they leave out sometimes. They are also part of the system because they see. Private workforce training. There are private training centers, private facilities for training that they leave out, but though they also should be part of that. That's why the issue of the site of also they were trying to. It's also part of the system that will serve the people in the country. So we have to look at it that in that sense. And another mistake they make is health systems are plural. When you call a health system, plurality is in there. There are so many things within that system. So mistake two is mistaken to think that studying health system means looking at the organization chart of the public sector. Some people mistake, if you want to study the health system, look at the organization chart, then that is the health system. It's not only the organization chart, it's only part of the whole thing, right? So that is the other mistake you make. When you talk about health system, it's not only the organization chart. And then understanding the system, analogy like the other system, economic systems are to society, what organ systems are to the body. Right? Society, you need the economic system to keep it going. Like the organ systems contribute to our body, keeping it going. Right? There is no system, there are systems. Right? There are systems. I said it's a plurality. Dysfunction is one affects other. As I that example also, if all had to work harmoniously in the system, if one doesn't missing, it will lead to dysfunction of the whole system. Right? What do systems do? Systems adjust, adapt, cohere. They have to work together. When things change, if one changes, then the other also have to adapt to that. So you have to adapt, adjust when you change. If some new technology is brought, then you change the way. Earlier, we didn't have laparoscopes. They had to cut open and do the surgery. Now, that is not necessary. They do the surgery through a hole. They have to do only a hole. How do scientists study? Reductionism, identify institutions, examine adaptations. So they study these changes. And you can't say there's no one best system. There are good positives and negatives of each system. So that's why we have to analyze and look at systems in that way. Institutions, when you talk of institutions, households are part of the institution. Primary health service delivery, there are primary level institutions, financial protection in system, like the insurances systems, governance, licensing, markets, and then drugs supplies distribution system. So can be different institutions which part of the system. Adjustments, folk remedies, clinics. Now, sometimes they have the special feeding practices have been adopted in these communications for malnourished people. They go have that clinics when it is people are distributed in faraway places. What they do is they go and carry out outreach clinics. So that is an adjustment. So not necessary to come to the clinic everybody. The clinic can go to the people. That here also we do that sort of thing. Insurance, trying to lower the co-payment, minimize the people licensing, various new things are coming in. markets, making a drug over the counter, all that. Examples of adaptations. Decentralizing governance. Now, when we adapted to the new constitution, 13th Amendment was brought in 1987. So after that, we decentralized the services. The provinces were asked to run the preventive services and the smaller institutions. So that is an adaptation to the new law, new governance. Okay, we health sector also adapted to that. Starting a government health insurance program. Then there was a need. Some people cannot afford it for the public servant. They started the Agrahara insurance scheme, right, which will cover the people when the costs are going up. And then in China, they have these barefoot doctors working. Example of coherence, relying on tradition, using market signals, commanding and controlling the bound, like motivation is important, and giving various incentives to follow the practices. Power is related to motivations that are operating in a system, like control of money, titles, space, assets, power of coercion, control of information. There are various laws also brought in now. And so, this is an example. We have given an assignment for you. Then instruments in health systems. There are direct controls using having regulations, prohibitions, compulsions. There are indirect controls like taxes, subsidies, and grants. Uh, Government as a consumer, government as a producer. Government interventions. Government provides services, provides health insurance, the Agrahara scheme, provide health care, maintains healthy environment, inform people about healthy lifestyles. It sustains fund health research, funds health worker training to sustain it, the production of health workers, and it maintains standards, license health workers, approves drug and devices, approve hospital. There are various regulatory mechanisms which the government now under the drugs authority. So there are, as we discussed, there are a mix of various objectives in the health policy, objectives about health insurance, objectives about health care, objectives about health, then the social objectives. Access, we use the term access to care. Access can mean many things. Access can be output, how much the output is there. Stability, fairness, efficiency, protection, freedom, innovation. So we have to study all these 7 dimensions across many institutions that make up the 7 major health systems. So we are discussing a health system. You can discuss in terms of, if you are talking about access to care by the people, we have to take into consideration these aspects. These are the various dimensions to assess the healthcare. When you are assessing healthcare, let me introduce you a simple model. I don't know whether I told you this. Please repeat it. A simple management model which you can derive these parameters easily. Why are we providing all healthcare? You all are working in different settings. Some are in the pharmaceutical, some are private colleges, some are government. Why are we all working, or why are we doing all this, providing all this? Why? Why are we having hospitals, laboratories, pharmacies, and providing this? Yeah. Because people need Yeah, people are suffering from various illnesses. We want to prevent people becoming sick. People are dying of various illnesses. We want to reduce the number of deaths, people dying early. So therefore, there is what is called a need. There is a need for healthcare. Right. To fulfill this need, what do we do? What do we do to fulfill this need? People are suffering on disease. People, we need to keep the people healthy. People need to take care when they become sick. So to fulfill this need, we do various things. What do? We develop policies that the responsibility of the ministry. System. What else we do? Services. We deliver services. We have hospitals and provide outpatient care, inpatient care, public hospital, private hospital. Then we have laboratories which do test and help in the diagnosis. Then we have physiotherapy services. So then there are surgical services to operate people, to do surgical operations. Right. So all there, what is happening to fulfill this need, we are carrying out various processes. We carry out various processes. All what you have said is what to why for? To fulfill this need. We carry out various processes, outpatient care, inpatient care, laboratory, operations, dispensing drugs, all that. Those are all processes. Now, to carry out all these processes, what do we need? Yes. You need resources. What are the resources? Finances. Money is enough to provide the. Yes. Money and materials. Those days they call the 3MC management. The resources for. Now people don't talk of the 3Ms. Right. Not five, yes. No, basically these are the basic ones. You can expand on this. Because to talk of only men, what about the women? So now we call human resources, financial resources, and physical resources. Right. So you use these resources to carry out these processes to fulfill these needs. Any other resource other than this? You said 5, but the other 2. What is the other 2? Any other resource other than these 3? Physical resources, human resources, financial resources. Are there any other resources other than these 3? Infrastructure is physical. Buildings, ambulances, information. Information is the resource. Yeah, everywhere it is there included. Finances, there is information, human resources, resources other than these 3, which we use in management to do anything, to manage. Yes. any other resource. But is the most valuable resource. The most valuable resource, which we compare to gold. Time. So don't forget about that. Time is compared to what? Kale, Rana, Samati. Why they compare? What is the difference between time and these three resources? Why it is compared to gold more valuable than this? Yes. Money, if you have too much, you can put in the safe, lock it and keep it till you what you take. Time, can you put in the safe? You have enough. People say that you don't have time. We have enough time. How much? 60 seconds? 60 minutes? 24 hours? 365 days? And we say no time. Enough time is there, but the problem is we start losing the time. Money we put in the same kind of, but time you can't lock it to use late. You have to use then and there, otherwise that's why it is called material resources, equipment, things you can lock in the storeroom, and when you need you can take out and use it. Time can you store in the storeroom and lock it. So that is why, right? So don't forget about that. Time is also important resource. Right. So there are needs. To fulfill those needs, we carry out various processes in the health system, and we use resources, human, financial, and in management. Instead of these, we use one term. In management, we use one term to capture everything. What do you call? What we use for this process? We call the word, use the word in. Right. Then you do various processes. What do you produce? In the hospital, what do you produce? Output. Okay, sorry, output. What? How do you measure that output? How do we say the hospital we said outpatient care is provided, the processes, outpatient care, inpatient care. So outpatient care, how will you measure your output? How much outpatient care were given? Yeah, what is the statistic you use? Yeah. Yes. Visits and new visits and revisits. That's all the statistics we collected. Say OPDs, there's a register, they and put that first visit and subsequent visits. Number of patients treated. That is the output. For a day, we treated so many. That is what the process. So many inpatients treated. So many inpatients cured. So that is the output that you measure. Laboratory, how will you measure the output? You do processes there. Number of tests done. You can then you say number of WBCDC done, number of blood sugars done. So you can measure the output of the laboratory. Theatre, number of surgeries performed. Major surgery, minor. If you want, you can do so many herniectomies, so many appendicectomies, so many bypass surgeries. That is the output. uh, in the MOH, Medical Officer of Health Office, how do we measure their output? They are also doing processes. Immunizations, yes. Number of children immunized. Number of mothers treated or mothers examined. That is the output. So, the processes we deliver various outputs. Is that what we expect from the health system? To treat so many people, to do surgery on so many people, to do so many tests, is that what we want? Yes, through that we expect people to be healthy. Less number of people children dying of immunizable diseases. Less number of children suffering from poliomellitis disease. So that is so many people. Less number of people dying early in their life due to diseases. That is we call the outcome, the end result. That is what your need is. Your need is that people are dying or people are suffering from illnesses. You want to reduce them. Mothers are dying due to pregnancy during the delivery. We want to reduce the maternal mortality. That is the need. We don't want the mother to die at childbirth. So that is the outcome we expect. Mothers go through the delivery without any problem. That is the objective, the outcomes, what we want to expect. And all this happens, who provides? From where does these inputs come from? From where does, who pays for these inputs? Yes. People. Why? They pay taxes and right. So people and one. We collect, get that, and we carry out various processes using those resources. Resources are provided by them. Who gets the results, output and outcome? People. What we do is we get resources from the environment, from people. We do various things within our system and we deliver to the people in that way. We can go beyond that, this also. If you reduce the number of people suffering from the illnesses, number of people dying of various illnesses at a younger age, we reduce the number of people becoming sick, what will happen? We do immunizations. Children die of measles, children suffer from measles and get complications like pneumonia, and sometimes they die. Right? If you give immunization, they will not suffer from measles, they will not die of measles. So what benefit we will get? child, if we don't immunize, what will happen to the child? Child will get measles, get complicated by pneumonia. If the child gets pneumonia, what will you do? We had to hospitalize. We had to be treated as an inpatient. What are the costs involved in treating a child? How many days we have to treat the child with pneumonia complicating measles? 10 days. What are the costs involved? Keep the child in the hospital, we have to spend money. What are the money spent for? Medication, investigations, the salaries of the staff, meals to the child and the mother, electricity, water, security services, all that cost. How much it will cost to treat this child for 10 days in the hospital? You were just talking about the charge is a private hospital charge. You say down hospital. Real cost. All this. If we to immunize that child, what are the things we need to do? What are the resources we need? Processes we need to carry out. We immunize, give a measles injection. Small clinic. Right? Refrigerator feed the vaccine, cold chain, but here your midwife's salary very small. And vaccine. How much it will cost to give one immunization to a child? How much it will cost? 1,000 or 100 to 200 rupees per dose. Cost of immunizing the child. Now, if you spend that little money and immunize the child, what will happen? That you are 75,000 is safe. What can you do with that? What will the government do with that? Europe, they can build more roads. Because the tax money goes, if you don't use that, that can be used for development. What will that have? It will have an impact on the population. So, outcome leads to impact. Right. We talked about, when we talked about policies, we talked about efficiency. When you looking at this, tell me what efficiency is. This model management. Efficiency is what? With the minimal input. So you are looking at the input, okay. You spend as little as possible and you get the maximum. So you are looking at input and output when you talk of efficiency. There are 10 patients who needs to be given injection in the ward. The hospital ward, there are 10 patients in the ward who has to be given 10 injections. We can use one nurse and give all the 10 injections. or we can use 10 nurses and give the 10 injections. So which one is more efficient? First instance, because we are using 1/10 of the resources we are using for the second. So you divide output by input. What will you get? Proportion of these 10 patients divided by 1 input is 1 less. 10 into 100 gives. Second one, 10 divided by 10 is 100. 10. So there it's 10 times. If we call it the efficiency. So input and output. There are 2 midwives. Midwife A, in her area, she has 100 children who should be given measles immunization. In midwife area B also, there are 100 children who have to be given measles immunization. Midwife, both are given the same amount of vaccines, support, transport, everything, salary, and were asked to do the immunization program. Midwife A gives all 100 children the immunization. Midwife B, out of the 100, he has given only to 80 children immunization. Now who is better? Who is more efficient? Both were given the same amount of efficiency. Okay. 80 efficiency is 100%. 100 divided by 100. So 1. Midwife B is only, out of the 100, only she has immunized only 80 children. So you say midwife A is better than midwife B in terms of efficient. Midwife A is efficient. Midwife A, you are saying midwife A is good. Better than midwife B. After 2 weeks, some children from midwife area A comes to your hospital with abscesses, or some children has got disease. Well, total 100 few children come to your hospital. They have got abscesses in the site where they live. Midwife area B, nobody comes like that to the hospital. Now who is better? A or B? Now you say, what did you look at? Why? Yes, outcome is better in we are looking at the outcome, but the need is to reduce the number of children suffering from measles. Outcome is then there must be a reduction of children getting measles. But in midwife area, few children have got, although with immunization given, some few children have got measles. So the outcome is better with the midwife B. Again, you divide the outcome from the need. How much of this need has been fulfilled? So what do you call that? You call it effectiveness. effectiveness. So remember the two words, efficiency and effectiveness. Efficiency equals what? Output divided by input. Effectiveness equals outcome divided by need. What does effectiveness tells you? To take the midwife, two midwives. Midwife B is more effective, but midwife A is more efficient. What do you mean by midwife B is more effective? Yes. Quality of the work. Both they have less work, but they have done the little work well. The quality of the goodness of effectiveness is there. Midwife A's quality is not good, he has not sterilized the needs properly or they have not maintained the cold chain problem. So effectiveness is not. So that's why. So remember this management model useful. I have taught you a full management lecture in 15 minutes. Remember this, in any question you can use this model and you can answer. Okay. Then when you talk of evaluation, you use this model. You can evaluate the efficiency, you can evaluate the effectiveness, you can evaluate the cost effectiveness. You cost this, how much, and you look at the cost. You can look at the cost benefit. We call it cost benefit analysis. You look at the impact. What is the benefit we have got? How much money we have spent to do that. That is called cost benefit analysis. Okay, so remember this management model. So access also you can look at in terms of the output, stability, fairness, efficiency, protection, freedom, sovereignty, innovation, all that terms. So we discussed health versus healthcare, insurance, the economic system, health systems, the 7 words and the dimensions. Okay. Any questions? Okay, we'll stop for lunch and afternoon we will look at a little bit about health financing and look at international and local agencies, and then after that we'll go do some questions so that we'll be ready to answer. You don't have to study if you follow the basics I teach you here. Okay. We'll meet at 1:50.